Welcome again to the Race Dental Academy webinar series, episode 18, and the last one for 2021. I can't believe we've got through this year. We've come out of lockdown. It's been such a year, and we appreciate everyone that's been through all of these episodes. But episode number 18 and the last for 2021, increasing patient case acceptance. And it's such a topic that so many of our clinicians have been looking forward to. The numbers are reflective of that today. Ladies and gentlemen, we have a topic that so many of our clinicians, they have beautiful practices, they cut beautiful preps, they use a quality lab, they know how to cement a restoration, but what they struggle to do is to get the patient over the line. There's no use being good at what you do if you don't have patients to work on. So we've approached who we believe is probably Australia's and New Zealand's most prolific patient case acceptance, Dr. Fred. Dr. Fred's been in practice, had his own practice for 15 years and is now the clinical director of the Urbano Healthcare Group. He has many accolades from LVI through to neuromuscular dentistry. I've asked Dr. Fred to give us his own bio in his own words because it's far greater than I can explain, and there's some words in it that I can't pronounce as well. But I must admit, before I hand it over, Fred, I'd like to introduce your biggest accolade, and one that's close to my heart was doing an all-on-6 full-arch implant retained hybrid denture on my mother-in-law. So you can see that the trust I have in this clinician of ours is second to none. But with no further ado, I'd like to, before we go on, over 60 registrants today from Australia, the UK, welcome from the UK, the US and Malaysia. So we love the international globalization of the Race Academy webinar series, bringing the world together through education. But with no further ado, I'd like to pass you over to Dr. Fred.
Hey, thanks very much, Matt. Really appreciate the intro. And yes, it's always a challenge when you've got to deal with anyone's mother-in-law, but especially the mother-in-law of someone that you really highly value. So again, thanks. Hey, listen, I'm going to be running through this a million miles an hour. I love to provide real pragmatic advice, and I like to give a lot of content. So I know this is going to be recorded and available on the Race Dental website. So again, even though I'm going to be running through this quite rapidly, hopefully you'll be able to pause, fast forward, rewind, etc. in the future. So just allow me the opportunity to run through as much as I possibly can, because I like to give as much information as I possibly can in a short period of time. Thanks very much to the Race team for the invitation this afternoon. The presentation, as Matt mentioned, is going to be focused on ways to increase patient treatment acceptance, really through the art of communication. My name is Dr. Fred Calavassy, and I'm the Clinical Director for Urbano Healthcare. We currently own 104 practices in Australia under the Maven Dental banner and 115 practices in New Zealand under the Lumino brand, with a publicly known scheme of arrangement being undertaken to purchase 1300 Smiles as well. So yeah, a little bit about myself. I live in the greatest city in the world, or arguably one of the greatest cities in the world. I'm not a full-time professional speaker, but I have spoken on numerous occasions for varying different overseas facilities, etc. And I've spoken at dental conferences around the world on aspects of clinical treatment and personal development. So I really enjoy passing on information and sharing knowledge. I am a dentist and a clinical educator, and now sit with the senior leadership team of the largest trans-Tasman dental support organisation. So I get to see and be part of a lot of stuff in the industry, which is really quite exciting. I'm really passionate about educating and passing on knowledge, but this isn't really something that that we often are exposed to. We often go and we talk about the minutiae of adhesive principles, or the chemistry of material structure, or smile design, or digital communication, yada, yada, yada. But I'd really like to prompt people to ask questions and to question themselves. And hopefully you'll get one thing out of this in this presentation, which is of value. I also like to share a little bit about myself, because by understanding who I am, it may also give you a little bit of an insight into you know, how we do communicate. This is my wonderful family, and who inspire me every day. And although my wife and I are now empty nesters, we're still we still continue to learn as parents, as we gather experiences together. And this is all part of the communication and the journey that we're on. I built my practice on sound communication principles, and I'd like to share that information freely with you today. So I ask you to take a leap forward with me. This is me jumping off some little bridge where some guy wrapped my feet around, and I'll tell you what, the colour of the uniform there, that was actually a fancy dress party that I was at, but I'm glad I was wearing that colour khaki, because it's not something that I'm going to do very quickly again in a heartbeat. So let's look at dentistry from a patient's perspective. You know, ultimately, most people don't want to be there. They don't want to be in a dental practice. They'd much prefer to be having a coffee with their friend if they're out of lockdown. Most people resent our fees. You know, it's not something that fundamentally, you know, is relatively cheap. It's not like you're going and buying an ice cream. And most people tend not to understand the intricacies of the treatment that's being performed, or the hours of education to achieve that little tiny filling that you've placed in their head. Understanding that you know, microtensile bond strength to the dentine, or the flexural strength of the material that you've chosen, or the aesthetic contours, etc., that you've created to mimic the beautiful biology of their dentition. And people want their treatment to last forever. You know, they're expecting that little filling that you put in their mouth, despite the fact that they're chewing on it, spitting on it, you know, producing acid environments, etc., they want their treatment to last forever. And from a dentist perspective, you know, we have a product or a service that people don't really want from you. We've got a product or a service that people would prefer not to have if they've got a choice. We've got a product or service that is really unknown. People don't know about the intricacies of dentistry. If you ask them about their big screen TV, they'll probably tell you more about their big screen TV than they will about the ceramic inlay that you've placed in their dentition. And you're selling a product or service that has an expectation, as I mentioned, of lasting forever. And you're tied to that product and service that you supply to that patient, because once the patient pays, they believe that you have to ensure that service is lifelong as well. So, you know, how can we align our perspectives together? And it really comes down to providing patient-centered care. So what does that mean? What does patient-centered care mean? Well, if we break it down, the most important part of patient-centered care is obviously the patient. It's the people that we care for. And it's centered, or it's focused on the people that we care for. And the care that we provide is really just that. It's the care that we provide. So what's the most important part of these three major components of patient-centered care? Well, it comes down to communication. Communication is the most important aspect of patient-centered care, leading to good customer service. Everything comes from good communication. Because let's face it, what we say and what we do is much more powerful. What we say is much more powerful than what we do. And we communicate every single time we interact with a patient, whether we're interacting with a patient via our teams or directly with the patient. And as I said, what we say is much more powerful than what we do. Our words are extremely powerful. You could be the best in the profession, but if you can't communicate, you will not be successful. And the reverse is also true. I've seen people who can communicate really well, but are actually really quite poor clinicians, but they're extremely successful. And why is that? Because it's not in the power of the dentistry skills that you have, but it's in the power of communicating to your patients. And we communicate to build relationships with our patients and to develop trust. Whether we know it or not, patients are looking at us and trying to grow that trust that they have in you. Because if they don't trust you, they will not accept treatment. Trust is the pinnacle and very important, highly important in understanding or a patient accepting any treatment that you undertake on them. And we know that relationships strengthen and grow our practice. If we have relationships with our patients, then we know that they are going to be referring. It fosters those referrals. and more patients will be coming into our practices, and our practices will continue to grow. And also the way we communicate with each other within the practice is extremely important. You know, I've sat in practices where occasionally a dentist will roll their chair back and yell down the corridor to the assistant and say, "Hey, can you grab me that flat plastic, please?" You know, is that really the way that we should be communicating with each other? Yelling down the corridor, requesting some instruments, or getting frustrated at our assistant because they haven't actually got the materials ready for that procedure that was a surprise to them, etc. So the way we communicate with each other indirectly is also building trust that patient has within you and your team as well. And what we need to communicate to every patient in every single communication is the why we do what we do, not what we do or how we do it, but why we're actually doing what we do for that patient. So what is the why? Well, it's that we care about you, that we want to get you out of pain, that we want to prevent problems from developing for you. We want to make you look better. We want to improve your function. We want you not to be afraid. We want to cause no discomfort for you, and we want to make your visit very pleasant. So we need to communicate all these things to the patient so that we can develop a relationship which builds trust. And what the patient sees is that they start to see that, oh, wow, it's all about you, Mr. or Mrs. Patient. Everything that we're doing is about the patient, that patient-centered care. And the patient hears, wow, it's all about me. It's you care about me. You care that I want to be you want to get me out of pain. You want to stop problems developing for me. We want to make me feel better. Wow, that's awesome. That's what they're hearing. They're hearing you communicating about them, not about your holiday, not about what you did last week, or the fact that you're frustrated with your assistant, or that something's not ready, or that you're running overtime. They want to know what you're doing for them, and more importantly, how enthusiastic and why you're doing what you're doing with them, because you want to truly help them. You want to care about them. Because as I said, communication builds a relationship, and that fosters followers. More people will come into the practice because they'll start to trust you because you're talking and feeling about them. Because people don't care how much you know unless they know how much you care about them. Just think about that for a moment. I've seen so many dentists presenting treatment to patients. You know, but Mrs. Jones, you've got a hole, and to fix that hole, I can fill it. I'll use a filling material that's cured with this really cool ultraviolet light, and it bonds to the tooth with an adhesive that has a bond strength of dentine of 41 megapascals. Like, really? And the patient just wants to know, yeah, but doc, you know, will it hurt? So people don't care how much you know. They don't want to know all the things that you know, realistically. They just want to know, what are you doing for me? Why are you doing what you're doing? So how do we communicate with our patients? Well, we know we've got verbal communication. We speak to our patients. And we also have non-verbal communication. And what patients actually hear is predominantly, not always, but predominantly that non-verbal communication. They're looking at your reactions, your eyes, the way you interact with your dental assistant, the way you interact with them, those non-verbal cues, etc. So when we look at this office, what do we see? Do we see organisation or disorganisation? Do we see busyness or calmness? I see busyness. Maybe it's really well organised, but I'll tell you what, I wouldn't want to come into a dental practice that has an office like this. We also need to actively listen to our patients. What does that mean? It means actually listening with our ears, not focused on what you're going to be doing on the next patient or worrying about the next hygiene visit that you're going to be jump into to do a quick exam. But it's really actively listening to the patients. What are they telling you? What do they want? What do they feel they need? And of course, we're now using a lot of electronic communication, which in itself is a another unique way to communicate with our patients, but it tends to lack that emotional connection. So it's a lot more difficult to communicate with electronically via all these different means compared to, you know, having that non-verbal communication in a face-to-face environment. So when I think of communication as well, and I think of experience and patient experience, or even customer experience, and I look outside of the dental practice, I always think of, you know, a five-star hotel and the non-verbal communication that a five-star hotel provides. And it's a good example in that hotel industry with that five-star experience. You know, in a five-star hotel, there are many aspects of communication that are non-verbal and very, very powerful. That beautiful foyer is inviting you, and it's made of high-quality materials. That's inviting. It's basically saying, come to our wonderful hotel and experience our wonderful service. If you're lucky enough to experience the spa in a five-star hotel, the sights that you're greeted with really exemplify calmness, relaxation. The sounds that you hear are calm, they're soothing, and they provide a sense of relaxation. All of this non-verbal communication is occurring in a five-star hotel. The touch of the fine quality materials, the marbles, the textured sculptures, etc. All of these are delivering that non-verbal communication that, hey, we are here to provide service to you. The smells and tastes that you'd expect from their fine dining restaurants, and the small touches that they provide to make you feel welcome. The little chocolate on the pillow to say, hey, we're really looking forward to you enjoying your stay with us. From the greeting at the check-in to the checkout process, and even the after-sales service, every aspect of a luxury hotel experience spells service. It communicates with us non-verbally, the quality to make us feel special as part of that. So why is that important? How can we relate, you know, a five-star hotel experience to dentistry? Well, it's pretty simple. And this is a quote that I really hold dear constantly, and I bring up, because people will forget what you said, people will forget what you did, but people will never forget how you made them feel. I remember a really good example of this, and it really hit home with me when I was sitting at a conference one day, and we were at as we always do at the end of the conference day, we're sitting at a pub somewhere and having a few drinks with some fellow colleagues and having some good times. Again, I think the most dentistry that I've learned is probably in a pub rather than in a conference, talking to my fellow colleagues and learning from their expertise. But what I found really interesting once, and I really enjoy the art of communication, but what I found one time is I was talking to a clinician, and all I was doing was really asking them about them, what they were doing, what their experience was, you know, where they're at in their career, etc. We didn't really have a lot of time to interact. But later on during the conference, towards the end, I had a friend come up to me and said, "Oh, did you speak to Dr. So-and-so?" And I said, "Yeah." I said, "We had a really great conversation." And they said, "Oh, they said that you're a really nice guy." And I said, "Oh, that's interesting," because I didn't say anything about me. They knew nothing about who I was, or they never asked me who I was. But the reason they really enjoyed the interaction is because, again, I allowed them the opportunity to speak about themselves, allowed them the opportunity to understand that I was actually really interested in them as an individual. And we can do the same with our patients when we're talking to them and communicating with them. Because through communication, you'll increase your case acceptance. If something touches your feelings, you'll be telling other people, whether it's positive or negative, you'll be telling other people. So if you befriend your patients, they'll not tweet something bad about you. They won't send you a thumbs down on Facebook. They'll actually make an excuse for you. If you've perforated the floor of the endodontic access, they'll make an excuse. That must have been a really difficult situation, Dr. Fred. because you've got a friendship, you've befriended them, and they have full trust in you through your communication. Because the goal of effective communication is to strengthen the relationship between you and your patients. And this leads to increased trust, which we've spoken about. It leads to an increased value on your services. It distinguishes yourself from other clinicians. It leads to an increased number of patients following through with their treatment acceptance. Why? Because they trust you. They can see the increased value because you're giving them the why you're doing what you're doing. It leads to a greater number of referrals due to the foundation of trust. It leads to a decreased chance of conflict between you and your patients, which decreases the amount of patient complaints. So ultimately, we use communication to sell our dentistry and the services that we provide, not as a salesman or woman, but as a professional who cares for their patients' well-being. So now I'd like to introduce you to a concept I learned some years ago and found extremely valuable in clinical practice. I'd like to introduce you to Robert Cialdini. He's a social psychologist who has authored many books, including Influence, the Psychology of Persuasion. And it's a great concept since as clinicians, when we present treatment plans, we're realistically selling treatment to the patient and we're influencing people to buy the services that we provide. And Robert speaks of 6 influencing factors, which I'll go through one at a time, and I'll try and relate those influencing factors. This was more related to sales, but realistically, we're selling dentistry. And I have no qualms in saying that we sell dentistry, and we're doing that for the betterment of the patient. We're doing that because what we know, if we see an incipient lesion, if we see caries progressing close to the pulp, we know the outcomes that can cause. We know that if we don't, assess and treat periodontal disease, that will lead to, bone loss and tooth loss, etc. So I want to try and relate that sales, which is really what we're doing, to dentistry. So the first of these influencing factors was reciprocation. So people tend to return a favor. If you do something good for someone, they'll tend to return a favor. Now that I've treated Matt's mother-in-law, he owes me for the rest of his life. So at the end of the day, he's going to be constantly providing these returns of favors. I'm kidding, Matt, you know that. So what does that mean? In practice, you might be able to do some complimentary children examinations or do a wedding clean for a patient by providing something that a patient feels as though, or getting a patient in at an appointment that you've really struggled, or they've struggled to find a time that suits your needs, but to try and flex to that particular patient. If you give something to the patient, they'll feel an obligation to reciprocate that favor. Commitment and consistency. Once people have made a choice or taken a stand, they're undergoing some internal pressures to behave consistently with the commitment that they've just made. So how does that relate in practice? Well, as an example, I remember speaking to patients before I would even go into the clinical treatment room. We would have a discussion trying to understand what they want, trying to understand exactly that they are part of the diagnostic process. So allowing that patient to self-diagnose as they will make the choice to commit to treatment will result in them being consistent to that commitment. If you can get a patient to state, hey, doc, shouldn't we fix that tooth now? Then they've made that commitment and they're asking for your help to restore that tooth. And just by making that commitment, they want to be consistent with that commitment and they'll tend to accept their treatment a lot easier. The next thing is social proof, a little bit more challenging in dental practice because people will do things that they see other people doing. I did a little experiment when my kids were a lot younger, and I like to play with communication skills, and this was a really cool one. We were walking along a beachfront in a really busy walkway, actually, in one of our city beaches. And I said to the kids, watch this. This is when I just heard about this. I said, let's do this experiment together. And we stood there, and I pointed up to a tree. There was nothing in the tree, but I pointed up to the tree, just like these people in the crowd are doing. I pointed up to the tree, and then I got the kids to point up to the tree and look intrigued as well. And as people were walking past us, everyone was sort of walking past, and all of a sudden they'd look up at the tree trying to see what we were looking at. Because socially, people wanted to do things that they see other people doing. We were looking up at the tree. People were curious, and they wanted to look up at the tree as well. So in practice, you know, these are things like testimonials, friends and family referrals. Now, I know that there are dental board registration standards with regards to testimonials, etc. But to have a patient, or asking a patient to refer their friends and family, as an example, is extremely powerful with regards to getting social proof, getting your patients to ask their friends and family to refer to you. We implemented a referral system within our practice, and it all just started with that one simple question, which is our assistant asking the patient, Mrs. Jones, you know, how did you find that appointment? And then Mrs. Jones would respond, oh, great as always. You know, I've been coming here and I love coming here. I've been here for, you know, many, many years. And then the assistant would respond as part of this to take that one step further and say, you know, thanks so much, Mrs. Jones. We've always tried to make your visits as enjoyable and comfortable as possible. Isn't it nice to have such a great dentist like Dr. Wonderful? He's always so gentle and makes you feel very relaxed, doesn't he? And as soon as Mrs. Jones turns around and says, yes, definitely, he or she is great. We'd love to have lovely patients like you. To show our appreciation and assist us in growing our practice, we'd like to give you our VIP referral card, which will reward not only you, but the person that you refer. That's social proof. That's the strength of social proof. And you can develop a whole system around just asking for referrals. Authority. People will tend to obey authority figures, even if they're asked to perform objectionable acts. So, you know, it doesn't harm to have your degrees, your diplomas, a discussion between the team while you're not even in the room around the recent course that you've attended, sitting in on a blog that you might be posting on your practice. Have the team speak about you, and the way they speak about you is also really important. You know, if they turn around, and the way you speak about your team is also important. You know, if your assistant has just completed her radiography diploma, then share that with the patient. Say, oh, you know, Mrs. Jones, I just wanted to share how wonderful, you know, Miss Brilliant is as my DA. She's just passed her radiography examination, and now we've got an additional service that we can provide to our patients. We are so blessed to have that level of expertise in our practice. Or Dr. Wonderful is an amazing clinician, you know, and we've got a couple of assistants talking to each other, or talking to the patient, you know, saying Dr. Wonderful's an amazing clinician, and he's always attending conferences and finding ways to better himself or herself. You know, you're very lucky that you're part of this practice, Mrs. Jones. So that authority is really important because it provides an opportunity for a patient to endorse the decisions that they've made in undertaking treatment acceptance. And lastly, which is extremely powerful, is liking, because people are easily persuaded by other people that they like and that they know. So remember what I said, people will forget what you said, people will forget what you did, but people will never forget how you made them feel. So don't jump into presenting a major treatment plan unless the patient knows you. You may as well not even discuss that at the early phases. You know, if a patient comes in and you present a large treatment plan and they don't know you and they haven't had an opportunity to like you, they will not accept treatment. So you may need to take that a little slower. You may need some frequent, more pleasant contacts with the patient so that they can develop a relationship and build rapport with you and develop that trust. The process may involve an examination followed by a consultation appointment. So these frequent little touches to the patient, with the patient, can lead to a development of liking. Because that allows the people to like you as a person before they like you as a dentist. Because it's harder to like you as a dentist rather than a person. Because most people don't like dentists. How many times have we heard that? You know, nothing against you, Dr. Fred, but I really hate dentists. So I always used to respond, nothing against you, Mrs. Jones, but I really hate patients. No, I'm just kidding. So it's really important that we get the patients to like us through our communication skills and our style. And the last of the factors of influence that Robert Cialdini speaks about in his book is scarcity. Because perceived scarcity will generate more demand. We all know, you know, we think of a restaurant as really great as an example if it's really difficult to get in. They've probably got tables. Sometimes you've seen it and you sort of walk up to the entrance of the restaurant. You can see all these free tables and you say, oh, you know, we'd like a table for two. And they ask that really great question, have you made a reservation? And it's like, oh, no, but, you know, I'm sure we can get a seat. Oh, no, I'm sorry, we're fully booked today. It's like, damn, okay, well, can we book for next week? So that scarcity provides that perception and will generate some demand. And the cookies in this jar always taste better if there's only a few left. So use scarcity language, use scarcity in our communication. Not that we don't want to, if we've got an available appointment, we want to get the patient in. But fundamentally, you know, I know Dr. Wonderful will want to see you as soon as possible for that restoration. Though because he or she is so popular, it might be difficult for them to see you in the next few weeks. How about I place you on a sooner if possible list so that I can prioritize you in the event that anything pops up sooner? Even if you call, you know, Mrs. Jones that afternoon and say, guess what, we've got an appointment available next Monday. All right, that scarcity has created that thanks, that reciprocation. You've done something for the patient to say, wow, thanks so much for getting me in sooner. And you guys must be fantastic if you can't get a patient in for the next few weeks. So there's sort of a balance because you want to remain busy and keep your productivity up as well. So a summary of the tools of influence, again, reciprocation, a commitment, allowing a patient to make that commitment themselves because they will be more inclined to follow through with that commitment. The social proof, asking for referrals, etc. The authority of knowing exactly what you're doing and having the team speak about you and each other as a level of authority. Liking you, it's extremely powerful because, again, people will remember how you made them feel. And scarcity. Because remember, the goal of effective communication is to strengthen the relationship between you and your patients. And as we mentioned, it leads to increased trust, increased value of your services, increased number of patients, greater numbers of referrals, and a decreased chance of conflict. So critical, so critical. And again, I know I've said this twice now, but people will forget what you said. People will forget what you did, but they'll never forget how you or your team made them feel. And when you do this, you will have an opportunity whereby people will want to see the treatment that you want to provide. They will ask you, can you undertake this treatment for me? Many of these cases are the wonderful work of Matt and his team. So some of it isn't, but some of it is. And patients will be asking this of you because when you make people feel cared for as part of your patient-centered dental services, you will become, no doubt, very, very successful as a clinician. So now when I'm asked to give presentations, I always, throw out at a bit of a pitch. The reason being is because as clinical director of Maven Group, we're always looking for good clinicians to join our group. So very quickly, before I run to Matt for some questions, if there are any, I know I've been running a million miles an hour because, as I said, I wanted to get as much content as I could into this presentation. So I'm sorry if I was running a million miles an hour, but as I said, I'm hoping you got a great deal of content out of this presentation. So why partner with Maven? Again, if you go on to Maven Dental Partners website, we also have Lumino, but fundamentally this is for Australian-based practices. We do provide the opportunity for clinical freedom for our clinicians, and that's really, really important. Allowing our clinicians the opportunity to use their professional judgment to undertake the clinical care is extremely close to my heart. We provide professional and reliable teams. We provide clinical support as well. So we do have a clinical advisory board, and we're now partnering with our clinicians. We have a health and safety team, preferred supplier agreements, compliance and legislation, which is becoming much more complex as time goes on. We provide business support and personalised analytics, marketing as the back end for patient growth. So we can provide these patients to you, and then it's up to you and your communication skills to convert them. And we also provide educational opportunities throughout Australia and New Zealand as well. So again, as a group, I welcome. That's my personal email address. So by all means, don't hesitate to reach out if you've got any questions. If you've got any detailed information that you'd like to share, by all means, share it with us. If you'd like to join our network, by all means, flick me an email, and we'd love to have you on board. So even if you just like some advice and support, again, I'm here to help and pass on that knowledge as I have to Matt and the team. So Matt, I've run really quickly through that program. I probably could have spent a little bit more time expanding on a few things, but I'm just wondering if any questions have come through, or if you have got any prelim questions. We're ready to go for those.
Yeah, Dr. Fred, firstly, thank you for such a simplified and dynamic presentation on how a practice should be run. For the first time in 18 episodes of the Race Academy webinar series, the numbers climbed constantly as you were talking, Fred. Normally we have people dropping off here and there, but I've been watching the participant numbers and they climbed during that whole presentation. So it's a real credit to you. And your education, and the Urbano Healthcare Group are lucky to have someone as a clinical advisor and educator such as yourself. I can see why they've been so successful and continuing to grow. The art of communication, you've mastered it, Fred, and even the way you presented your presentation today really goes to show you how good you and how well you do it. Just jumping back there to my mother-in-law, Fred, look, she was extremely nervous. The all-on-6 you did, she was anxious. By memory, we had Biomet 3i had their camera crew filming the whole thing as well, which added to the angst. I was photographing for a presentation that I was going to give. The room was full of camera crews, and you've made her feel loved, cared for, and calm. So in that particular environment, you're doing extraction of 6 teeth and placing 6 implants for an all-on-4 case for immediate function. No pressure, mate. You did it well, and to watch you in that environment sure was special. And look, and just as another accolade, I remember back when Wheeland were launching their ZX system, and they asked you to be the clinical demonstrator and for the case, and they asked me to do the technical work for the case. And not only did you make that patient feel calm and appreciated, but you're probably one of the only dentists that made the technician feel cared for as well, mate. So I wanted to thank you for that. Those memories are still fresh today. So not only do you make your team and your customers and clients and patients feel special, but as a the technician involved with the case too, you did it for me. So that's another thing I wanted to thank you for. With reciprocation, I thought that was a very important component. People feel obliged as well as wanting to give back when you give. And I know that I gave you the gift of a difficult patient in my mother-in-law, and look, the fact that you gave it back, I feel that we're quite even on that one too, mate. So look, I'm lucky that I do have a mother-in-law that I do love. But look, again, we do have one question coming through here, Fred. How do you balance the need of getting patients to like you with trying to communicate information to protect yourself after treatment?
Wow, that's a really good question. And it obviously is a real balance between, going into the details of the intricacies of different options, as an example, with treatment planning. But there's no need to go into such minutiae of detail to a patient, as long as they understand globally exactly what the options are, if we're talking about treatment options. Your clinical records are what reflect the detail. So your clinical records are extremely important. The discussions that you've had with patients, in a broad sense, should be reflected in your clinical records, and that will really protect you as a clinician to, in the event of a complaint or a conflict with a patient. However, I will say one thing: it's very rare that you will have a conflict or a patient complaint if they like you, if they've developed that rapport with you, if they've got that trust with you. It's very, very rare. I've gone through 30 years plus as a clinician, and I've had one major complaint against me. Now, sure, you're going to get patients who might be dissatisfied with, a restoration that might have fractured prematurely, as an example. But again, if they like you, a lot of the times they'll say, "Oh, Fred, I'm really sorry, but I broke that great filling that you placed in my mouth." It's almost like they're apologetic that they've done something that you now have to repair. So I think developing that rapport with the patient is extremely powerful. So I don't know if that's answered the question, but it's really trying to get that balance of developing rapport, building trust to minimize the risk of patients complaining, as well as providing them adequate information to allow them to make an informed decision based on the treatment options that you provided to them. And you can ask them, you can literally ask them back and say, do you understand the treatment that we're proposing? Can you describe that to me, Mrs. Jones, exactly in your words as to what you think this treatment is that I've proposed is going to do for you and your tooth. So if they regurgitate that and they've told you that again, then again they're confirming that in their own words, and that's something that can be reflected in the clinical treatment notes. It's quite common as well that in certain litigious environments, the consent forms may not necessarily hold a lot of weight. I think it's important that you do provide consent forms, especially for more complex treatment. However, just be mindful that there is a very big difference between consent and informed consent. So a patient understanding the type of treatment that you're delivering is much more important than the consent form that they've signed. They need to understand the treatment that you're delivering. And how does that occur? Through communication.
Yeah, excellent response. We've got a couple more questions coming in. I think that answered some of the other ones around the Dental Board Code of Conduct and a few things there. Look, for those of you that don't know, Fred had an hour lecture lined up today, and I put the pressure on him to cull it down to 40 minutes. So he may have felt a little rushed, and if you felt that way, that's probably my fault more than Fred's. We did have to get going. We do have a limited time here to make sure we can all get back to our clinics and benches within the hour. Fred, I would hope you could just leave us with one thing before we go. We will wrap it up now. I'm sorry we can't get through more questions, but if you would give us one last point of view, if there was one thing after 15 years of successful practice running and then becoming the clinical director of one of, if not the best healthcare group in Australasia, besides communication, what would be number two to running a successful practice, mate?
Oh, wow. Geez, that's putting me on the spot there, Matt. You can't provide dental services unless you're providing dental excellence. So, it's all well and good. As I said, I've known many great successful practices that can communicate really well and sell dentistry, but their work is quite horrific, to be honest. So I think the combination of providing good communication skills in conjunction with and hand in hand with delivering excellence, delivering quality dentistry, will make any dental practice successful. So yeah, I think that's something that I would strongly encourage every clinician, and I'm sure every clinician that is on this call, the very fact that they're on this call shows a thirst for knowledge, a thirst for wanting more, and educating themselves in delivering clinical excellence, whether it be through communication or, bonding that indirect ceramic inlay to the tooth. Anything that we can do to improve the delivery of clinical excellence is extremely valuable. So I would encourage everyone to continue that journey of education as much as they can. Find their weakness, focus on your weakness, and make it become a strength.
Yeah, well, great answer. There's no doubt knowing what you do and doing it particularly well is also good. Look, Fred, we've run out of time. I do appreciate you taking the time today. I know you're a busy man. I know the Urbano Healthcare Group are lucky to have you. And if anyone's interested in taking advantage of the clinical excellence, the technical support, the business acumen that the Urbano Group can provide you so you can focus on dental excellence, contact Fred at fred.calavassy@urbanohealthcare.com. I'm sure they'll be happy to help, and you could join one of their 104 practices in Australia and 115 in New Zealand. And good luck with the Urbano Group, with Daryl and his 1300 team. Another strong acquisition that you guys are looking into. I'm most impressed. But look, if anyone wants more information from Race, feel free to get contact with customer support at racedental.com.au, alternatively Matt at racedental.com.au. Our new Race Dental web portal or customer portal is now live, so go to racedental.com.au for complete communication and secure communications. But Fred, I thank you once again. You've been a wealth of knowledge. Is there anything you'd like to leave us with?
No, all good. Just stay safe, obviously, in this ever-changing world that we live in, and look forward to the run towards Christmas and the putting another 2021 behind us and welcoming 2022. So all the best to everyone, and thanks again to the Race team for the invitation. Always love doing things with you guys, and I appreciate the opportunity. So thanks very much. Have a great afternoon, evening, wherever you live.
Thank you very much, Fred. And for those of you that want to see the record, it is on racedental.com.au under the education section. But I thank you all for joining us again. Thank you, Dr. Fred Calavassy. We hope to see you all next year, the Race webinar series. See you. Thanks again.